Ever had to get an IV when you're at the hospital?
Oof, yeah.
I mean, it seems like such a routine thing, right? Like, no big deal. Everyone gets them. But what if I told you that those little IV catheters fail?
Oh, yeah.
Way more often than you might think.
Way more.
Like, almost half the time.
Yeah, it's true. The research is pretty clear on that. We're talking about a 35 to 50% failure rate, even in hospitals, with experienced nurses. It's kind of a hidden problem in healthcare.
Okay, so let's unpack this. We're doing a deep dive today into some research about why these IV catheters fail so often. And before we go any further, what exactly do we even mean by failure? Is it just that the initial stick didn't work?
Well, not quite. We're talking about the catheter not working as it should before it's supposed to be replaced. You see, they used to replace these things every few days, just as standard practice. But the research shows that a well-placed catheter can actually stay in much longer. We call that dwell time.
Okay.
But even with that knowledge, these things are still failing at kind of an alarming rate.
So we're talking about a procedure that has like a 50-50 chance of needing to be redone, possibly before it was even due for a replacement. That's a coin toss on whether you're going to have a smooth hospital stay or a really uncomfortable one. And it's not just about the inconvenience, is it?
Absolutely not.
Yeah.
Think about it. Every time a catheter fails, it means another stick for the patient, right?
Right.
Another needle stick. It could delay them getting the medication that they need. And on top of that, to add insult to injury, it increases their risk of complications like infections. It's a cascade effect.
So not only are you dealing with whatever landed you in the hospital in the first place,
Right.
now you've got the added stress of like a botched RV potentially multiple times.
Exactly. And here's where it gets really interesting. Each failed attempt actually damages the vein, making the next try even harder and riskier. And then there's the cost factor. I mean, think about the wasted supplies, the extra time that nurses and doctors have to spend on reinsertions, treating those potential complications. We're talking billions of dollars annually.
Wow. Okay. So we've established this is a big deal.
Huge.
Yeah. With a ripple effect that impacts like everyone, not just the person hooked up to the IV. So let's get into the why. The research breaks down 5 ways these catheters can go wrong. It's like a medical mystery, only without the exciting detective work.
Right. Think of it this way. You have this machine, the catheter, and it's interacting with another super complex system, the human body. And sometimes those two systems just don't play well together. The 5 main ways things can go wrong are phlebitis, infiltration, occlusion or mechanical failure, dislodgement, and infection.
Okay, before we get lost in medical jargon, can you break those down for us?
Gotcha.
Which ones are the most common culprits?
I got it. The most frequent offender is phlebitis, which is just a fancy word for inflammation of the vein. Then there's infiltration, which is when the catheter punctures through the vein and leaks fluids into the surrounding tissue.
Oh, no!
Definitely not a comfortable experience for the patient.
Ouch, yeah, that sounds pretty rough. Okay, what about the other 3? Occlusion, dislodgement, and infection.
So occlusion is basically a blockage in the catheter. Think of it like a kink in a hose. Something is preventing the fluids from flowing properly.
Okay.
Dislodgement is pretty straightforward. It just means the catheter has come out. This happens more than you'd think and really highlights the importance of properly securing these catheters. And finally, we have infection. This one is thankfully less common, but obviously the most serious because it can have, some very serious consequences.
Right. It's interesting how each of these failures kind of points to a different vulnerability in the whole system. It's like a chain reaction waiting to happen. Let's start with the most common one, phlebitis. What's going on there? Why is this inflammation happening so frequently?
Well, like any good mystery, there could be multiple factors at play. With phlebitis, we see 3 main types: mechanical, chemical, and infectious. Each one has its own set of triggers, but they all lead to that same uncomfortable inflammation.
Ooh, a trifecta of troublemakers. Tell me more about these different types and how they contribute to the overall failure rate of IVs.
Let's start with mechanical phlebitis. This is all about the physical interaction between the catheter and the vein. If that catheter moves around too much, it irritates and inflames the vein wall. It's like a tiny little splinter that keeps rubbing against your skin. This is why properly securing the catheter, to minimize movement is absolutely crucial.
So it's like that annoying tag on the back of your shirt that just won't quit?
Yes.
A small detail that can cause a big headache, or in this case, vein ache.
Precisely. Now, with chemical phlebitis, it's actually the medication itself that causes the irritation. Some medications are just naturally harsher on the veins than others. The good news is that diluting those medications properly can make a world of difference.
It's like they say the dose makes the poison. Even something that's meant to heal can backfire if it's not delivered in the right way. Fascinating stuff. What about that last culprit in the phlebitis lineup, the infectious kind?
This one's a bit more serious, though thankfully less common. Infectious phlebitis happens when bacteria, those microscopic troublemakers, manage to set up camp near the catheter's insertion site. This can happen during insertion if sterile techniques aren't followed meticulously, but it can also happen afterward, if the dressing isn't doing its job of keeping things clean.
So it seems like even a tiny slip up at any stage of the process, from the moment that needle goes in to how it's cared for afterward, can open the door for these complications. It makes you wonder, like, how often are those sterile techniques being overlooked in practice?
That's a great question, and one that researchers are actively investigating. There's actually been some eye-opening research highlighting, like shocking rates of contamination, even in settings where you'd expect strict protocols. We'll delve deeper into that a bit later. For now, it's important to understand that any break in sterility, even something as seemingly insignificant as touching the catheter hub with a glove that's touched another surface, can introduce bacteria and lead to that, nasty infectious phlebitis.
Wow, that really puts things into perspective.
Right.
It's amazing how these tiny, invisible things can have such a huge impact. Clearly, like, attention to detail is critical in this process.
Absolutely. Speaking of details, let's move on to another common issue, infiltration. This is when the catheter goes right through the vein and leaks those fluids into the surrounding tissue. And as you can imagine, it can be incredibly uncomfortable for the patient.
Yeah.
Interestingly, this study found that the catheter's design itself might actually play a role here.
Okay, so we've got a potentially rogue catheter rubbing a vein the wrong way. Now we're saying the catheter's like blueprint might be part of the problem too.
You got it. The material and size of the catheter can significantly impact those infiltration rates. It turns out that stiffer catheters, like those made from Teflon, are more likely to poke through a vein compared to the softer, more flexible ones made from polyurethane.
So if we're picturing this, we want a catheter that's more like a bendy straw as opposed to like a rigid piece of plastic.
Exactly.
Avoid those ouchies.
It's all about minimizing that risk of a sharp tip causing damage. And the size of the catheter matters too. It might seem counterintuitive, but using a smaller catheter and having to stick someone, multiple times, especially if it's someone who is still learning the ropes, can actually increase the chances of infiltration. It's actually better to use a slightly larger catheter and get it right on the first try.
That makes sense when you think about it. The more you poke around, the higher the chances of something going wrong. It really highlights the importance of having, those skilled professionals who can like get it right the first time. And let's not forget about those securement techniques we talked about earlier. A moving target is so much easier to miss, or in this case, accidentally puncture.
Absolutely. Securement plays a major role in preventing both mechanical phlebitis and infiltration. In fact, the research points to dislodgement, the catheter coming out, as being heavily linked to poor securement.
Right.
There was one study that found it was the most common reason for having to restart an IV.
Okay, so we keep circling back to securement. It begs the question, why isn't there a completely standardized, foolproof method for securing these catheters that everyone follows religiously? It seems like such a no-brainer if it's causing this many problems. But before we get too deep into that rabbit hole, let's talk about those last two culprits, occlusion and infection. What did the research have to say about them?
Well, occlusion, that blockage we were discussing, often ties back to the same issues we've already talked about. Catheters moving around, inflammation, and sometimes even improper care. Just think about it. A catheter that's constantly shifting is way more likely to get, kinked or blocked. And inflammation, whether it's caused by mechanical irritation or the medication itself, can narrow the vein and restrict blood flow.
Right. It's like a domino effect where one problem can lead to another. It shows how interconnected this whole system really is.
Exactly. And then there's infection. While statistically less common than the others, it poses the most serious risk to patients. The research actually delves into two main ways infections can develop. It can be contamination from the outside getting in, or contamination that happens during the actual insertion process.
So it's like a fortress that has multiple weak points where those pesky bacteria can stage a takeover.
That's a great way to put it. One study found that even something as simple as touching the catheter hub with gloves that have come into contact with other surfaces can contaminate it. The research also highlights the role of biofilms, Have you heard of those?
Biofilms, they sound vaguely familiar. Give us a little refresher.
They're basically these slimy layers of bacteria that love to cling to surfaces, and they make infections a lot harder to treat. Imagine bacteria building a tiny little fort that's really hard for even, strong antibiotics to penetrate. That's kind of what a biofilm is like.
Okay, so biofilms are definitely not our friends. Not a fan.
Yeah.
So we're seeing this pattern emerge. 5 catheter failure is influenced by like a whole bunch of things, from the materials and design of the catheter itself to the techniques used during insertion and how it's cared for afterward.
Mm.
Even down to the microscopic level with those like sneaky biofilms, it's like a perfect storm of potential problems.
You're exactly right.
Yeah.
And that's precisely what makes this research so important. It's shining a light on a procedure that we often take for granted
Mhm.
and revealing these surprisingly high failure rates.
Mm.
It forces us to ask, what are we missing here? What can we do better?
It's like everyone just assumed this procedure was as good as it was going to get, but this research is waving a giant red flag and saying like, hold on a minute, we can do better for patients. And asking those tough questions is what this deep dive is all about. We've uncovered the what, the why, and even some of the how. But the million-dollar question is, if we know about all these issues, why haven't more effective solutions been implemented? It's mind-boggling.
I agree. It does make you wonder. That's what we'll explore after a quick break.
It's kind of wild when you think about it, right? Like, we're talking about a procedure that is so common in healthcare, yet it has this surprisingly high failure rate. And the reasons for those failures aren't exactly a mystery. It's not like we don't know what the problem.
Other surfaces. The research itself kind of points out some real head scratchers.
Yeah.
For example, we know that just touching the catheter hub with a glove that's touched, anything else can contaminate it.
Right.
So why aren't we using completely sterile gloves for every single insertion?
Right. It seems like common sense. And what about those dressings? You'd think they'd be designed to create like a super strong barrier against those biofilms we talked about.
It does seem like there's a lot of room for improvement, not just with the catheters themselves, but with the entire process, the dressings, the techniques, everything. And let's not forget about securement. We've talked about it a lot today, but it's because it's so crucial.
Yeah.
If we know that a loose catheter is a recipe for disaster, why isn't there a universally agreed upon method for securing them that everyone is like trained on from day one?
Right. It's like we have all the pieces of the puzzle, but we're not putting them together in a way that actually makes a difference for patients, but complaining about it won't get us anywhere. So what can we actually learn from this? Let's say someone is listening to this, maybe they're even heading to the hospital soon themselves. What's the takeaway for them? What should they be thinking about?
I think the biggest takeaway here is the power of awareness.
Yeah.
As patients, we need to be informed about the procedures, that we're undergoing. We need to understand that we have a voice in our own care. Don't be afraid to ask your healthcare provider about their 4V insertion techniques. Ask them how they ensure the catheter is secured properly, what steps they take to prevent infection.
So it's about being like your own healthcare advocate and speaking up.
Absolutely. You have every right to safe and effective care. If something doesn't feel right or you're, having discomfort, don't be afraid to say something. You're your own best advocate.
Yeah, it's so easy to just kind of go along with whatever the doctors and nurses are doing, especially when you're in such a vulnerable position. But you're right, we need to remember that we have a voice.
And this research isn't meant to scare anyone. It's about empowering people with knowledge so they can, make informed decisions about their healthcare.
I love that knowledge over fear. So we've learned that 5E catheter failure is a surprisingly common problem. It can have some real consequences for patients, and there are absolutely things we can do to minimize those risks.
Exactly. And it really highlights, I think, a bigger issue within healthcare. Even those routine, everyday procedures have room for improvement. It's a reminder to always ask questions, seek to understand why things are done a certain way, and never just settle for good enough when it comes to your health.
Because sometimes good enough just isn't good enough at all. We've seen that with those IV catheter failure rates. It's a wake-up call for everyone, both patients and healthcare providers, to prioritize education, stay up to date on the latest research, embrace new technologies and techniques, and never stop looking for ways to improve patient care, even in the smallest details.
I couldn't agree more. It's about cultivating a culture of continuous improvement in healthcare, We wouldn't accept a 50% success rate in other areas of our lives, would we?
Yeah.
Imagine if your car only started half the time or your phone only made calls occasionally.
Right. We'd be demanding refunds. So why do we accept it when it comes to something as important as our health?
That's the million-dollar question.
Hmm.
Part of it is historical context. These procedures have been around for a long time, and sometimes it's just easier to keep doing things the way they've always been done, even if it's not the best way.
It's the old saying, if it ain't broke, don't fix it. But as we've seen today, even things that aren't technically broken could still use some serious improvement.
Exactly. And that's where, research like this comes in. It challenges the status quo and makes us reevaluate those practices we've just been taking for granted. This isn't about placing blame. It's about working together to find a better way.
Well said. So as we wrap up this deep dive, what's the one thing you hope listeners will take away from this conversation?
I think the biggest takeaway here is the power of awareness. As patients, we need to be informed about the procedures we're undergoing. We need to understand that we have a voice in our own care. Don't be afraid to ask questions, advocate for yourself, and seek out healthcare providers who are committed to those best practices.
It's been an eye-opening conversation, that's for sure. It just goes to show that there's always more to learn, even about the things we encounter every day.
Curiosity is key.
Yeah.
Never stop questioning, never stop seeking knowledge, and most importantly, never underestimate the power of advocating for your own well-being.
Couldn't have said it better myself. That's all the time we have for today's deep dive. Until next time, keep exploring, keep learning, and keep asking those great questions.